Namaste. My name is Swami Yalaswaram. I'm one of the faculty members at Sri Sri School of Yoga. So today I'm going to talk a little bit about diabetes. What is diabetes? Diabetes mellitus is considered a metabolic disease, meaning there is the control of glucose is impaired, and it results in significant excursions of blood glucose. And for most of the day, people with diabetes have what is known as hyperglycemia, or a higher than normal level of glucose in their bloodstream. So what are the consequences of diabetes? This hyperglycemia can affect many different organs in our body. It can affect our eyes, leading to impaired vision. It can affect the kidneys. It can affect the extremities of our body. And in extreme cases, it may require amputation of the leg because of gangrene setting into the leg. Those are really extreme conditions, but it is possible if diabetes is not adequately or properly controlled. So those are the consequences. Then the question comes up, why? Why would somebody develop diabetes? Turns out there are two major reasons. One is the genetic predisposition. Many people are somewhat predisposed to development of diabetes through their genes, right? And the other thing is lifestyle, how we live, how we eat, how we move about, all of those things. And genetics can play a dominant role, but lifestyle can certainly add to it or take it away from it. It can modulate the effect of genetic predisposition. Now, much of the emphasis when we talk about management of diabetes, people think of medicines. Of course, medicines are extremely important. People also think of diet and exercise. All of those things are certainly components when it comes to management of diabetes. But there is one part of it that is often overlooked, and that is the mind. You know, when there is stress in the mind, that impairs glycemic control, then that increases the release of insulin, leading to insulin insensitivity. That can happen. This is pretty well established in the literature, the effect of stress on diabetes. But where does this stress develop and where does it get stored? It actually happens, the stress is at the level of the mind often. Even though we may feel some pains, discomfort at the level of the body, the stress gets accumulated in the mind. Anytime we worry about things, we are anxious, we are afraid of something, all of these leads to stress. And many times we are not even aware that stress is accumulating in our system, but it does. And when it gets to a certain point, it can affect many of the physical functions, including the disposition of glucose through the functions of insulin. So I'm going to be kind of more focused on that for today. What can we do to alleviate that? So it's important to have the mind settle down and bring the mind to a calmer place, to a happier place, what we call as a pleasant state of mind. So how do we do that? We can definitely do that through the combination of yoga asanas, the bodily postures. Second, through pranayama, through breathing techniques. And thirdly, through meditation or dhyan. The combination of these three elements are extremely effective in the management of many of the diseases, including diabetes. So today I'm going to highlight one pranayama and one asana, and just briefly mention meditation at the end. Okay, if we all can sit down, sit comfortably, easily, with the back straight, spine erect, and rest your hands on your knees, palms facing up. And now I'm going to talk a little bit about a powerful breathing technique called Kapalbhati. This literally means in Sanskrit, shining forehead, but it actually refers to an exercise or a breathing technique that can lead to sharpening of the intellect and enhancement of the memory. At the same time, this pranayama leads to an increase in basal metabolic rate, enhanced basal metabolic rate, which means improved digestion, and that in turn can help with the management of glucose by increasing the basal metabolic rate. And the way we do this is very simple. The emphasis in Kapalbhati is in the exhalation, forceful exhale. We squeeze the abdominal muscles and pull the navel towards the spine as we exhale. And then the inhalation happens effortlessly. So we sit straight, normal breath in and breathe out. And then we start Kapalbhati using a count of 1 and 2. When I say 1, you inhale. With 2, you forcefully exhale. And continue. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, and relax. Now this is one set, and you can do 3 sets of Kapalbhati. If you do this on a regular basis, meaning at least once every day, this certainly will have a significant impact. Now second, I'm going to highlight an asana. This asana is called Ardha Matsyendrasana. Seated spinal twist is the English translation. To start with, we sit with our legs extended, back is straight to the extent possible, and bend your right leg. Keep the right foot on the other side of the left knee, toes pointed straight ahead, and go ahead and fold the left leg and bring the left heel close to the right buttock. And now straighten the knee, right knee, so the right knee is facing the ceiling, right foot is straight, right toes pointed straight ahead. Raise your right arm and place the right hand on the floor behind the body, close to the midline. Now pick up the left arm and hook around the right knee and see if you can grab the right ankle. If that's not possible, you can simply keep your fingertips facing towards the ceiling like this. And lastly, if you're able to, look over your right shoulder and bring the right arm behind your back. See if the shoulders are both are lined up, and look over your right shoulder. Your right thigh is pressing against your belly. And normal breathing. And to come out of it, release the right arm, release the left arm, and stretch out both legs. Now we will do it on the other side. Take your left leg, place the left foot on the other side of the right knee, and fold your right leg. Right heel to the left buttock. Adjust the left leg and raise your left arm. Place the left hand on the floor behind you. Right arm comes up. Hook around your knee. Grab your ankle if you can. Look over your left shoulder. Pick up your left hand, left arm behind your back. Hold your core muscles. Look over your left shoulder. Continue breathing. Release left arm, right arm, stretch out the legs. So this is Ardha Matsyendrasana. You can do it a couple of repetitions, slowly increasing the duration over which you hold the posture. And finally, meditation. If you can even meditate for 5 minutes using one of the guided meditations that we have on the Art of Living Journey app or any other source you have, that really adds to the practice of asanas and pranayama. In one of the future segments, we will talk more about meditation, but know that the combination of asana, pranayama, and meditation can go a significant way towards the management of diabetes, along with other interventions like diet, aerobic exercise, and pharmacological treatment. Namaste.